All right, we are live here with our April edition of our Provider Facebook Live. Really excited today. We have a pretty special guest with us, Dr. Henry Zaremba. So Dr. Henry and I go back quite a bit. We actually went to school together. We went to chiropractic school together, and he's gone off and has done some really cool things, some really niche specific things when it comes to brain health and TBIs and brain injuries and different things like that, which I got to see him study through school and really put in extra hours in learning all of those unique things, which is really cool. And we've obviously stayed in touch, and I'm really excited to have a conversation today about brain health and spine health and how are they connected and what does that mean. So first of all, Doc, if you don't mind just introducing yourself, a little bit about your practice, what you're doing, and kind of how you came about that.
Sure. No, appreciate it. And, thanks for the kind words. Again, it's awesome to see the things that you're doing with your clinic to help people. And, we need more places like that around the country for sure. But, I'm Dr. Henry Zaremba. I am a board certified chiropractic neurologist. I work at Apex Brain Centers in Asheville, North Carolina, where we specialize in brain injury rehabilitation. We also work with people with learning and behavioral disorders, so things like ADHD, OCD, and a lot of times that's not exclusive from the brain injury thing. A lot of people with concussions end up dealing with those types of issues too. And we also work with people with neurodegenerative disorders, which is a term that refers to diseases like Alzheimer's disease, Parkinson's disease, and other forms of cognitive decline. So, while I definitely have kind of found a really specific sort of category that our clinic is working in, as opposed to when I was first in chiropractic school, never lost sight of the spine. So that's why we're going to keep talking. We're going to talk about that today. But I was raised in Raleigh, North Carolina. So when I moved back here about 2 years ago, it was sort of like a halfway homecoming. But I went to undergrad at UNC Chapel Hill. While I was there, I played on the ice hockey team. Kyle will let you know too from our time in chiropractic school playing together. I spent a lot of time just trying not to get hit. But one time when I was in college, I got caught. I got a concussion. And it just seemed to affect me on another level compared to anything I knew. So I started reading more about the brain, came across a story about Sidney Crosby working with Dr. Ted Carrick, who's a chiropractic neurologist, and really credits him with saving his career. So it just kind of really started kind of sparked an interest, I guess you could say. I decided to pursue chiropractic school at Palmer, Florida. From there, I worked at a clinic in Colorado, working with kind of similar types of patients, a lot of focus on brain injuries. And then I've been here in Asheville for about the last 2 years.
No, that's awesome, man. That is awesome. So you're at Apex Brain Centers. Excuse me. You obviously talked about the populations that you deal with. What exactly do you do there? Like, give us a little insight. What does a day-to-day look like? What are maybe some common treatments that you're doing for patients? Like, what does that look like?
Sure. Yeah. So, I oftentimes explain it to people kind of like brain boot camp. A majority of our patients are going through our immersive treatment programs. So for that, we only accept 4 patients at a time because they get a lot of one-on-one time with myself, Dr. Trafer, the rest of the staff. But basically through those immersive programs, we're doing what falls under the category of brain rehabilitation, but it's a lot of things like physical exercises, cognitive exercises for attention and reasoning, memory exercises. We pay a lot of attention to systems that feed the brain information. So things like eye movement exercises, assessments of brain-body connection. There's a term called proprioception for that. And based on the testing, we come up with, what our specific plan for that patient's going to be. We have a lot of different tools in the toolbox. I always tell people it just kind of depends. But we're non-surgical, non-pharmacological. So we're not going to do surgery. We're not going to, prescribe medications. We're looking at things from more of a holistic point of view and helping people figure out how to build a better brain to live a better life, is kind of one way to put it. So some of the tools that we use pretty commonly are things like low-level laser therapy. We do a lot of different types of whole body vibration or localized vibration to try to change the way that the brain is processing signals from the body. We'll use a lot of QEEG and brainwave based techniques. So things like neurofeedback and entrainment techniques, where we basically try to shift the brain's activity to either a higher or lower frequency, depending on the needs of that particular patient. And then we also talk to people too about things like lifestyle factors that are going to play a huge role in their recovery. So things like nutrition, technology use, and even just learning. So many of us kind of get to a certain point in life, kind of have our job or whatever we do, and we just kind of know what we know and stay in our lane. But there's a lot of research now showing that you can keep your brain healthy just by learning new things. Download Duolingo and practice Spanish a little bit. So it's, I know it's kind of hard to describe what exactly we do, because there's a lot of different treatments that we offer. But we're primarily working with patients who have had some form of brain injury or stroke. We do work with people for wellness as well. And that's where a lot of times that looks like someone who maybe recently their mother or father passed, or is struggling with Alzheimer's disease or Parkinson's, something along those lines. And we'll basically take a look under the hood and see what we can do to help make sure we're keeping that brain as healthy as possible, because there's a lot you can do to prevent those diseases. Once they start, it gets a little trickier. But so that's kind of, a bit of the flavoring of what we do. We also offer single services. So some people are coming in just for things like hyperbaric oxygen therapy, laser therapy, chiropractic adjustments, neurofeedback. But the immersive programs is one of our main things that we do. And we serve people from all over. Worked with certainly a lot of people from Western North Carolina, where we're located. But just last week worked with someone from England. So it's cool to be able to kind of work with people from all over, get some different perspectives.
No, that's really cool. And I mean, it shows the expertise that you have, people from England, or anywhere, if they're driving from around the state or whatever it is. I mean, that's amazing stuff. So you obviously do a lot there. So one question I have, you mentioned wellness, and you work with people on wellness. What are people coming to you to try to protect their brain proactively sometimes from a wellness standpoint? And can you protect your brain from damage, doing anything fairly directly?
Yeah, absolutely. And that's where, a lot of times it's pretty well known, I feel like, in the common population of people that, there's some genetic components to some of these, age-related brain diseases. Most of the times you read about statistics, the rates just seem to be going up. And it can be scary, for people kind of getting to a certain point, and then, you forget your keys one day, and all of a sudden it's like, oh man, am I, really okay? But, even just on that note too, before even getting more into what we do with those patients, so many people, you kind of know, and it's almost like a joke, kind of, you see it on like sitcoms and everything. It's just like, yeah, when you turn 50, you go to the doctor and you get a digital rectal examination. Like that's just kind of like what wellness is at that point. But, I feel like a lot of people need more of a cognoscopy at that point, where we're actually looking at what is, your brain doing from a health perspective, because a lot of the research shows too that a lot of these degenerative processes like Alzheimer's disease are happening for about 15 to 20 years before we ever get even the start of symptoms. So that's where, yes, absolutely, people can protect their brains. And it looks different for everybody. That's where, genetics can play a role in things, and you can have your genetics assessed in terms of what your risk factor might be for certain disease processes. But the way that you can address that, you can affect the way that genes are turned on and off by certain people. So, a lot of times what wellness looks like is kind of coaching people through their lifestyle. What are habits that you have that are serving you? And then what are habits that you have that may be kind of setting your brain up for not the healthiest outcome in the future? And one of the most common things that we end up talking to people about in regards to that is screen use and technology. Now, we're not like anti-technology or, think you need to like throw all of your devices in the trash. But a lot of people don't even realize the effect of something as simple as watching TV right before you close your eyes to go to bed.
Mm-hmm.
Our brains are wired to be very reactive to light. We're very visual creatures, those of us that have sight. So for that reason, a lot of brain behavior actually can be dramatically altered based on the different light exposures. So looking at, watching a TV before going to bed, what you're doing is you're exposing your brain to frequencies of light that are similar to that of the sun. And basically what that's doing is that's telling your brain, oh, it's daytime right now. We need to be alert. We need to be awake. And that can really lead to the release of stress hormones. It can limit the release of the hormones that our brain needs to get into the deep phases of REM sleep, which is immensely important. When we're in REM sleep, we have increase of what's called cerebrospinal fluid flow, which is sort of the fluid that the brain is sitting in, which is hugely important for maintaining the brain's health from a cleanliness perspective. So it helps with draining things out of the brain circulation that don't need to be there. Kind of like as humans, we eat food and we create waste. Same thing with our cells. And we need to be able to get rid of that waste properly. And sleep is a huge important factor for that. And not just being able to fall asleep, but your quality of sleep is hugely important. So usually what we recommend for people is about 2 hours before bedtime, and you should try to have as regular of a bedtime routine as you can, because your brain likes routine. But 2 hours before bedtime, no more screens, no more phone, no TV. You can listen to an audiobook, if you need some sort of, something to stimulate you a little bit. But that's just one simple habit right there that if we project that over years of someone's life, something as simple as not watching TV right before you close your eyes to go to bed can play a huge role in how healthy is your brain going to be, 20 years down the line, 30 years down the line. Talking about things like sleep hygiene, talking about exercise, talking about the diet, and then sometimes we can intervene with some specific technologies if we're seeing there are some deficits there. But so many of the things, I always tell people, it's like so many of the things that you just know you should do for yourself, yes, I should exercise, I should eat right, I should drink plenty of water, I should get good sleep. Mm-hmm. All those things are good for you because they're good for your brain.
No, that's great. And it's like everyone, a couple thoughts on what you had said. First of all, I got these bad boys.
Beautiful. Got them built in. Yeah.
Those are my daytime ones, and I got orange ones for at night that I put on once the sun sets.
Great.
But for that exact reason. So those are just blue light glasses and with actual yellow lenses to help keep like blue and some green spectrums out. And then at night I use the orange ones that block most spectrums of light. And so even if I want to watch TV, I can cheat a little bit and hopefully help myself out a little bit. But one thing that you said, like a couple things stand out. One is that people always are looking for something new and creative, or maybe even expensive, or like the newest thing that's going to help them be healthy. And at the end of the day, it's like, it's the saying, like, don't major in the minors, right? Like, the major things that we know have the biggest bang for their buck. And those are all the super boring free things we can all do, which, like you said, is exercise, eat right, get enough sleep, stay hydrated, like maybe take some supplementation, whatever you got to do. But those are like the things that are talked about all the time. So people always want to be like, well, what else can I do? And it's like, well, you're not even doing those. So we don't need to talk about anything else.
Yeah.
So that's a big factor. And then something else I wanted to touch on, you talked about cerebrospinal fluid. So that's a huge point in what we do with our upper cervical work here at Shift. That's something we talk a lot about with our patients, because we've seen on MRI and Cine MRI, which is motion MRI, people getting pre and post MRI after an upper cervical correction, and the cerebrospinal fluid actually changes how it flows through the brain. If we have a small misalignment of the top bone in our neck called the atlas, it works on a vacuum, so if we have a slight misalignment, that can affect the vacuum, and we can get a big burst of CSF to one side and then none to the other side. In years and years and years of that happening, there's actually been cases where there's enough pressure that it's literally eroding the brain because there's so much pressure of it on one side. So that's just a huge, huge deal. And people don't realize that. Like when you're sleeping, like Dr. Zaremba said, it's like your brain literally starts filling up more with cerebrospinal fluid, and it just drains all the waste that's built up there through the day. I know one of the things that helps clear out a lot of is amyloid beta, and we know that there's a lot of evidence that's connected to Alzheimer's disease. So if we're just letting that sit and build up in the brain, it's going to create a lot of issues. And so So having said that, talking about the spine, right? Like,
Yeah, right.
what are some examples maybe you've seen in terms of spinal care and how that's directly impacted the brain?
Sure. No, obviously. So, I mean, so much of the basis for human movement comes from the spine. I think that's a good way that we can kind of frame things. And, we work with a lot of people who have been in severe car accidents or maybe had severe strokes, and their movement is limited. And then that's going to have other effects for other areas of the brain. But so much human movement really originates from the spine. If when I hold my left arm out like this, before my deltoid even fires, I'm getting signaling down into my low back to stabilize my back. Otherwise, I'm going to tip over this way. So the brain and the spine are just so closely in communication. They're like total BFFs all the time, talking back and forth and back and forth. And interestingly enough, it's kind of one of those funny things. Today, I had a patient come into the office who's dealing with some cerebellar atrophy. And essentially what that means is part of her brain is shrinking. And this part of the brain helps to control movement, helps to control speech. So she has this sort of resting tremor in her head. She actually has movements of her eyes constantly as well, too. And all of this started after her spinal fusions. So we can never, say 100%. There's no test that's going to tell us if that's the case or not. But, sort of, putting on our Sherlock Holmes costume and trying to find clues, that's really what everything is pointing to, before this onset with that person. So that's just a great example. I worked with a patient a few weeks ago, the one that I was preparing to talk about on our live session, who had a lot of difficulty with anxiety. So this patient has a history of concussions, and basically one of his main symptoms was just this sense of what we call hypervigilance, where the fight or flight system, our sort of anxiety system in the brain is never shut off for him. So he wasn't really sleeping, he was losing weight, and just dealing with this really severe anxiety. And we used different types of chiropractic adjustments. We did some whole body vibration and some different stretching techniques, some muscle tone modulating techniques, and even just cold laser directly over the spine. And we were able to see a measurable change in his chest expansion, meaning that every time he takes a breath, he's getting a little bit more oxygen. That's really important for things like anxiety. The part of your brain that helps to control sort of our sense of feeling anxious and our sense of emotional well-being is called the prefrontal cortex. And that's kind of the part of the brain that's right here behind your forehead. And it's thought of as sort of the most human kind of part of the brain. It's also one of the most selectively affected by any change to the amount of blood flow or oxygen that's going up into the brain. So essentially what we think was happening with this person was his anxiety was causing him to breathe shallow, which was having negative effects on his spine and his rib cage. And that was furthering his brain problems because he wasn't able to get as much oxygen with each breath. And like we talked about before, kind of like put that over, days, months, years of not breathing properly, that brain's going to get, a certain percentage points less oxygen than it would have. So that's where not only helping with movement and balance and, helping people stand up out of wheelchairs by addressing the spine, but helping people to regulate their own emotional output, helping people to feel okay psychologically, because we're, with what we do, we are always very clear with patients that we're not mental health providers. We co-manage with a lot of people in mental health, but they always tell us that the work that we do makes their job easier because they have better access to the part of the brain that's going to help them to sort through the feelings they're talking about and things like those lines. So the, it's not just about, having a healthy spine so you can have good, healthy posture and have a good, healthy core. It has so much to do with so many aspects of brain function.
No, it's spot on. And those are some amazing stories and testimonials. I think when you say, so can you connect the dots for people a little bit more on this when it comes to movement and how the brain and the spine talk? Mm-hmm. So you mentioned proprioception before. Mm-hmm. Proprioception is just how our body knows where it is in space. So if you were to close your eyes and sit and want to touch your own head, that's proprioception. You know where you are in space. How does that play into effect, and how does that actually lead to brain health? Because what can happen is when we have misalignments in the spine, we have what we call subluxations or different things happen. It essentially sends like faulty information up to the brain about how our body's functioning and how it's moving. So can you connect the dots a little more on how that can affect things?
Yeah, no, absolutely. So I think one of the ways we can really get into that is the idea of sort of segmental kind of control of the spine, because the spine is like this big chain of these different bones, and that's how it's able to move. And there's these really small muscles that connect the different segments, and they essentially work like gauges for the brain. So as these muscles stretch or relax, they either send signals up into the brain about their length, their tension, their duress that they're under. And then the brain can send signals down to the larger muscles to stabilize that area, help take stress off of these smaller, what we call proprioception muscles. When we have, for example, a concussion or some sort of change to brain health, the brain is going to focus on what's important, right? It's going to keep your heart beating. It's going to keep you vertical and standing upright. But things like emotional regulation or controlling every single one of these segments in the spine isn't going to feel quite as important when the brain is kind of spread thin. So when we're assessing someone for a brain injury, we need to assess the spine as well, because of this two-way street, this conversation that's going back and forth between these joints in the spine, these muscles that have these gauges that are communicating with the brain about how things are moving. And then that changes the brain's ability to sort of control and work things. It's kind of like if you need to, if we have to put some sort of object away or find something in a room and then we turn the lights off, it's going to be a lot more difficult. So the brain needs to be able to sense the environment appropriately, and the spine is one of the major ways that we can understand the environment from a brain perspective.
Yeah, that's great. That's great. I would love to touch on concussion for a second, because one thing that's always been really interesting to me is concussion. We think brain injury, but it's like the amount of force typically that it takes to induce a concussion. There's almost no way that it doesn't do some sort of damage to the neck. And I'm really curious too, from a post-concussion standpoint, of people who have ongoing symptoms that aren't improving, or people aren't returning to what they feel like their baseline was. I have my opinions on that, and I've seen like reverse cervical curves, and I've seen these different things. And then even recently, I've seen a case study and a case series published from the chiropractic biophysics group on one was actually a professional rugby player, and he was it was insane. He was averaging like 2 concussions per season or something like that. They have all this data on it and where he was getting tested and all these things. And he had either a straight neck or a kyphotic neck. Then he underwent a series of care, and they actually restored the cervical lordosis, and then they tracked him for like 2 or 3 more seasons. And I think he either had none or 1 concussion clinically during that time, just from having proper biomechanics of the neck where it could potentially absorb better impact. So I'm just wondering, that's one thing that's almost like preventative, but also if that happens, and we mentioned the CSF flow earlier, we also could talk about the vertebral artery, if there's a rotation of the atlas where there's a potential, or the internal jugular vein. I've even seen that on axial slices of MRI where it's starting to pinch down on that, so we're not draining blood from the brain. So in your opinion, from what you've seen, because you see way more of those patients than I do, how much of a factor could not getting your spine corrected post-concussion attribute to your recovery?
Well, it's major. I mean, the thing is, every step we take and just being upright on 2 feet, there's a lot of brain activity that goes into that. And that tends to kind of go out the window when a concussion happens. Basically, when we look at being able to balance and stand upright, there's 3 different systems that mainly contribute to regulating that. There's proprioception, like we're talking about, the brain-body connection. There's our eye movements, so being able to see, is the room tilted? Am I straight? And then there's our vestibular system, which is sort of our inherent sense of which way is up. It's kind of like a level that we have in our head where we can tell, even if we can't see or feel anything, we can tell which way is up in terms of gravitational pull. So when we're when we're rehabilitating someone from a concussion, we're always going to assess all three of those stools, because for most of us, except for some astronauts, we live all of our lives under the influence of gravity. And especially we find people with post-concussion syndrome, the way it works is that it's kind of like there's this shakeup that happens with the concussion, and the brain just finds a new way of doing things. And the longer you go after a concussion dealing with symptoms before you seek care, the more ingrained those patterns become. So for a lot of people, we find that addressing the neck just kind of helps to boost up the ability of the eyes to focus on targets. It tends to help reduce signals like dizziness and nausea. And, I've even seen, issues with neck tracking contributing to, people's depression. And I think it's because of all these different connections we've talked about, of how everything that goes into and out of the brain has to pass through those cervical vertebrae, especially those muscles in the neck. And even further on top of that too, so much of our brain body connection is actually right here. There are these cells called muscle spindles, which are one of the main sort of sensors that the brain uses to tell how we're positioned. And basically each of our muscles have different concentrations of these muscle spindles. The more muscle spindles we have, the better you can read something. That makes sense, right? Mm-hmm. So there was a study that I read where they were doing basically cadaver studies of these different muscles, and they were looking at the concentration of muscle spindles and the inferior oblique of the kind of upper cervical. So it's really tiny muscles, like we were talking about earlier, these really tiny muscles that work as gauges for the brain. This is actually the biggest concentration, grams per centimeter squared, of your muscle spindles in the entire body is right here, where the skull first interfaces with the neck. So we will oftentimes visually show this to patients on something called the homunculus, which is basically this picture of a representation of how much of the brain is represented by different body parts. And when people see how big sort of the head and the hands is the other thing too, how much of a role that plays in terms of huge proportions of real estate, are dedicated to controlling the neck, the eyes, and our vestibular system, and making that all make sense for the brain so that we can just do something as simple as standing upright.
No, it's really cool. And I think, I know what study you're referencing too, and it's crazy when you compare it to something like your lat or your pec or something like that, which have like 8 muscle spindles per gram or something, and then the inferior obliques like 150 or something like that. So it's very interesting. And part of that also explains how we can actually correct the neck, make an adjustment here, fix the alignment, so it actually evens those muscle spindles out. They're not spasming anymore. And all of a sudden someone's low back releases and they've had like low back spasms, and all we did was adjust here. They're like, what did you just do? It's like, we just restored balance to your body, and now it's not telling your whole spine to try to hold tight and correct everything because it's sensing damage going on. So yeah, really cool stuff. And I think that really makes sense too with depression. We see that all the time too, because you mentioned how all of these things are connected. Like when we start correcting people's spines, all the time we hear, hey, I'm sleeping way better. Would that have anything to do with what I'm doing here? Well, yeah, it's not a coincidence. I'm sleeping better. I have more energy. Oh, and we've seen depression and anxiety. We've seen a ton of improvement on that. One of our favorite patients, she started coming here shortly after we opened. I mean, it's probably been close to 5 years she's been coming here. And she used to get such bad anxiety attacks that if she was in the car, she would literally have to pull over. She wouldn't be able to drive for like an hour. She would just have to sit there. If she would get them at work, she would have to go under the desk and literally sit under her desk. We started correcting her spine. She hasn't had one of those attacks since. And it's just like, even us that we do it every day, like those stories are like, wow, this is pretty amazing stuff. So when we're talking about prevention, especially, like that's the one thing. And I know we like all of us talk about this all the time, but prevention is the best medicine. Prevention, not waiting to have those problems happen to you. Take care of your spine or your body or your brain or all of these things before they go wrong. Because health is something that can be difficult to get back. And it's also the one thing that if you don't have it, it's like all you're praying for. You don't care about anything. Like even on a minor level, we've all had those days where we're like super sick and bedridden. And all of us at the time think like, man, I would give anything to just feel better today. Right. It's the most important thing. but it's easy to overlook when we feel good, and we just let it slide. So.
Right. Right. No, absolutely. Coming from someone who, dealt with my own kind of battles with concussions, some of the, kind of mental health aspects of that, I notice it if I'm not doing the things to take care of myself too, and I tell patients all the time, if you ever sneak in here before hours, you're going to see me on half the machines you're doing, because I want to make sure I can, take care of you guys as best as possible and keep my brain ticking as long as I can.
No, that's awesome, man. Got to walk the walk. Got to walk the walk.
100%. Yeah.
Cool. Well, I'll tell you what, man, we're up at about 30 minutes here. So I think we'll call it. I know it flies.
Yeah.
I think we could talk about this stuff all day.
Yeah.
I really appreciate you being on here, and it's great to see you. I know we'll catch up again soon, but thanks for doing this.
No, of course, man. No, thank you. I love seeing the things that you're doing. Anyone out there in Traverse City, you need to go see this guy's clinic, because you'll be glad you did.
Cool. Awesome, man. I appreciate that.
Awesome.
We'll talk to you soon. Okay.
That sounds like a plan. Thanks, everyone.
Thanks.